Good evening, ladies and gentlemen. Welcome to the Tuesday, August 6, 2013 meeting of the Urban Village Development Commission. We have a full agenda as we normally do, but we normally, first of all, I'm calling the meeting to order, but we normally start the meeting with previous meeting minute approval. We apparently did not get the July 16th meeting minutes in our packet, so we're going to postpone that along with the July 2nd one, which we had postponed earlier due to some questions Nina had, and since she's not here, I'm going to postpone both of those to the next meeting, which is August 20th. So let's go ahead and jump right into the Swedish Development Agreement. Even though it says Sloman, I think we've got a special guest here, Keith Niven. Welcome back.
Thank you. So Keith Niven with the city's Economic Development Department. I'm here this evening to kind of kick off the conversation about the Swedish Development Agreement, to just give you some background on why we're processing a development agreement for a property that's inside of Issaquah Highlands, which is already governed by a development agreement, and we can get into the details after that. So what I think we had planned, if this makes sense to the Commission, is for me to give a little bit of a brief intro and then to turn it over to Swedish, who would like to, I think, talk to you guys a little bit about their project, their existing hospital and property, and what they plan to do with a potential purchase. And then I think Lucy will get into the details of the development agreement, which you guys have a draft copy of. So the development agreement that's in place for Issaquah Highlands was approved in 1996 and is going to expire in the next couple years. And so part of the reason why Swedish has asked for a new development agreement is it's likely what they're planning to buy from Port Blakely will take longer to build out than like 3 or 4 years. And so rather than face kind of the expiration of the development agreement and what that means, and we haven't really kind of worked through some of the mechanics of that. So for the properties in our urban villages, when the development agreements come to term, what the city needs to do is determine how to deal with the unbuilt properties and the entitlements and the densities, and basically put some zoning parameters on them if the development agreements will no longer apply. So where we are today is basically Swedish is potentially buying property from Port Blakely. It's across the street from the existing hospital, and all that seems good. And because of certain reasons, and I think they're going to explain that, you know, their potential build out will take longer than what the development agreement has. So we're taking the existing development agreement, and the development agreement, as you know, is the rules for how we approve land use permits for projects within the urban villages. And so what we're talking about is adopting a set of rules which will apply just to the Swedish property at the end of the day, if that makes sense. So that's really what we're embarking on. I think what Lucy will talk about with you is that we're not trying to recreate the wheel. I mean, the rules already exist in Issaquah Highlands. I think both Swedish and the city have expectations that the development will resemble the development that already exists in Issaquah Highlands, so it will look like it's part of the project and not something completely alien. But there's some things and there's some reasons why we're not going to take a 20-year development agreement and extend it another 10 years. There's just a lot of complications, and we can get into that later. So with that, I'm going to, hopefully that makes sense. If you guys understand the general framework, then I'd like to turn over to Swedish, but if you have some questions, I'm happy to jump into anything that you'd want to talk about at this point.
Thanks. Just a couple of quick clarifying things. So is it a foregone conclusion that a new development agreement will be made for this purpose? That's question number one.
So the answer is no. Swedish has asked the city. The city has agreed to start to process that. This is the process for which we would ultimately make a recommendation to the City Council to approve a development agreement. If through this dialogue we decide that it's unwarranted, or if there's another avenue that makes more sense, I think we're here to have that dialogue and explore that with you. So if there's reasons why a new development agreement on the Swedish property doesn't make sense, then I think what Lucy and I are ready to do is to talk about are there other choices. what would be the concerns of that, and I think we can explore that through our next two meetings that we have queued up for this project.
Okay, thank you. And then the follow-up on that, and you sort of answered it, is just to be clear on our role in this is, though we're working on this development agreement and sort of developing the development agreement, if you will, by working on this, we're not necessarily saying, yes, we should do a development agreement, but we're working through the process, and at the end, we will decide whether or not to recommend to the City Council, or we will recommend something to the City Council, whether to move forward, whether not move forward, make some changes, et cetera.
Right.
Okay, just want to be clear on what our role is.
So let me just add this.
Is your mic on, Lucy?
Okay, is that better?
Yeah.
Yes.
Okay. So two things I'd like to add, just because I think we need to do, or I need to do a better job of helping you guys understand what your purview and responsibility is. As Jeff said, you're making a recommendation to the council. So you're not the decision maker, you're making a recommendation. And your role is, it's sort of a planning level review, so not a technical review, but you're bringing your experience with other development agreements and what you've learned over the past, and as representatives of the community, your perspective on what it would best serve to achieve the vision and goals of this project and Issaquah Highlands and the community.
Thanks. And then finally, and we don't have to do this now, but at some point, I'd like to get a better understanding of what it means if there is no new development agreement, and what sort of the possibilities are if it expires, and whether it's Swedish or anybody else hasn't actually developed land by that date. What does that mean, and what are the consequences, the problems, the opportunities? What is the city likely to do, that sort of thing? We don't need to do that now, but I'd really like to have that conversation at some point. I don't know if you guys are interested in that, but to me, I think it's best for us to understand why we're working through a development agreement and what's the consequence if we don't, right?
And I think that can be answered two ways, and I'll let Swedish answer that from their perspective. So if there's not another development agreement, I think they can answer it from them as a potential buyer today. I think from the city's perspective, we need to put something in its place. There can't be nothing there.
Right.
For Issaquah Highlands, so what happens in, one choice would be you revert to the existing zoning that was there before you did the development agreement. Now for Issaquah Highlands, that was annexed into the city, so there was no pre-existing zoning on that property that was city zoning that we could revert back to. Mm-hmm. So what we've been talking about is, what could we do, and I'll just give you an example. So the Marriott property, I think there's a likelihood that the Marriott will not build before the development agreement expires. So the question is, what happens to that property? I think our perspective would be, we would look for a solution that would give that property owner some level of parity to what was allowed under the development agreement. Now, things like the CC&Rs that are on all of the property, the covenants and restrictions on the property, that would require like any property to go through the architecture review committee, that's going to be there even after the expiration of the development agreement. So there's certain things that being part of Issaquah Highlands is going to keep some level of rules and regulations that are just basically assigned to the property even after the development agreements expire. But in terms of what you can build there, I think what we're looking at is some different alternatives that exist in other cities that could be potentially assigned to those properties that are unbuilt, that would give them some level of similar density, building height, all those and land uses that are basically there now. But we haven't. But to just be honest, Jeff, that is on our work plan for next year. Mm-hmm. And so I think the city would just leave it as a big question mark for today. But our plan is to get that wrapped up before the development agreement expires, and the Highlands is the first one to expire. But they all expire at some point. You know, Tallis and Rowley and Lakeside, they all will expire because they all have a certain term.
Right. So to be clear, this is specific, though, to the Swedish property, or the Swedish, potential Swedish properties, not to the whole of Issaquah Highlands and what happens when?
Yes.
Okay. All right. Thank you. Jim?
I'm just curious, why not just, or can this happen? Extend the current development agreement and then just have addendums or something like that?
So my take on it would be the existing development agreement, because it's about 20 years old, there are a lot of standards in there that we wouldn't approve today. And so part of the concern about extending it another 10 or 15 years, depending on how long Swedish wants it to be extended, you're basically taking old standards and letting them go for another 10 to 15 years. I don't think we think that's a prudent thing to do. And in some cases, like with stormwater, I don't think we can do that. So this is our opportunity. You know, we want to preserve the kind of the flavor of Issaquah Highlands and what was created through that development agreement. But I think that there are some new standards that need to be applied for us just to be kind of current with what we've done with Lakeside and with Rowley. I think it makes sense to bring the standards that we've kind of brought up to this project as well.
Okay, and then lastly, will this, if there's a development agreement that comes out of this, and you may have answered this, hopefully not, will this apply to the other land that is there? For instance, the Marriott that's, okay, it'll be unique to the Swedish property. Okay.
Yeah, and for that reason, you know, this development agreement's a little bit different than the others. You can just see it's a lot skinnier. But, you know, it's not, it could be residential or it could be commercial. You know, it is basically for these guys. These guys have asked for it. It's for basically medical office and related uses. So it's going to be very specific on both property and land use, and that's going to be, it's going to seem almost more like a land use permit that way, because we're going to have some specificity on what's planned there that we don't with usual development agreements. So that'll take a little bit of getting used to, but I think that's what we're talking about. This is specific to just that property and just this applicant.
Great. Thank you. Okay. Move on. Lucy?
No.
Oh, sorry. Swedish. Sorry.
So,
Kick it off.
let me open this up. And if you're going to point to something, if you use the mouse, then it registers at home for people looking on the video. But you just point up and down or
If I
left and
want
right.
to move the
Yeah.
slides, this is
Yeah.
great. Great.
Sure.
That's great.
No problems. Well, good evening. Do I need to turn this on, or is it
Just
already
pull
on?
it closer to you, as long as the light's on.
Okay. My name is Chuck Salmon. I'm the Chief Executive for Swedish Issaquah and the ambulatory care centers located at Mill Creek and Redmond. And with me is Alex Gross, who is Director of Finance as well as Strategic Business Development for Swedish Issaquah and the ambulatory care centers. And we're going to spend just a few minutes giving you some background information on a very important topic for us. And quite honestly, I guess I would label it in a nutshell of our ability to continue to provide high-quality care and a very robust level of service offering for healthcare over the coming years by virtue of our need to expand. We've been very successful in our first couple of years of operation here, and really developing your hospital. We do see it as an asset for the local Issaquah, Sammamish communities, as well as further reaches of East King County. And we've been quite successful with our initial 19 months. I'll give you some information on that here in just a minute. But I guess for starters, just to give a little background on Swedish, the mission for Swedish is to improve the health and well-being of each person we serve. This actually goes back 100 years to our founding physician, Dr. Nils Johansson, a Swedish immigrant who was not satisfied with the standard of cleanliness and sterilization that was in place in American medicine back at the turn of the century. And he literally came out to Seattle with the express purpose of creating a hospital that was a creation of his own standard, and essentially the standard at the time of emerging high-quality care that was relatively germ-free, which was kind of a novel idea at that time. We are a 501c3 nonprofit healthcare provider, and as such, any margins that we make go towards our provision of healthcare services, the construction of buildings, the acquisition of equipment. We do not have basically distributions to stockholders if we do well financially. When we first started back in 2011 and 2012, we had a kind of a fundamental level of service offering that you see here. This is our starting services, and essentially we started off with that and essentially kicked off the operation of a $400 million investment that Swedish made over the previous 2.5 years. Excuse me. And Alex will show in a minute the kind of where we're going, or where we've been rather, over the last 19 months with growth and essentially the fairly rapid expansion of various services, as well as the volumes that are generated by the services you see here. As well, we have inpatient units that are comprised of general surgery, inpatient surgery, medical surgical nursing units, orthopedics, intensive care, labor and delivery, postpartum. We just opened this past month our level 2 nursery for premature babies. We're very excited about that, as well as a general pediatric inpatient unit. Our goal with the availability of these resources is to essentially capture or assure that there's the availability of 90% of the medical or health care that this population would need. By virtue of an extended relationship that, of course, we have with the mothership back in Seattle, tertiary services, those services that are very low in volume but high in complexity and high in risk, procedures like brain tumor removal, open heart surgery, transplants. We don't anticipate doing those procedures out here, at least in the foreseeable future, but rather leveraging the broader Swedish capabilities back in Seattle to do those services. But essentially, we would be handling the pre-op and the post-op care out here in Issaquah, again, as part of our ability to create a robust service. So by the numbers, over the last 19 months, you can see here a quick flash of where we've had activity. And surgeries are a little over 300 per month averaging now. We've increased the population of Sammamish and Issaquah, or at least contributed to the tune of about 1,572 babies over the last 19 months. And our outpatient clinic visits are approaching 150,000 with the physicians that we have available in our already, quite honestly, capacitated medical office building. And we'll talk a bit more about that with our plans for, or our desired plans rather, for the new property we would acquire. And then our actual workforce is right around 800 individuals, comprised of both outpatient and inpatient nursing staff, technicians, service workers, et cetera. And then our active medical staff is currently resting at about 250. As a community hospital and a nonprofit organization, we are obligated to, I think, reflect in our care the delivery of services to all aspects of the population that we serve. And we certainly do have, I think, a cross-section every day of individuals that live in our community, some of whom have resources to pay for their care and others that don't. And to the tune of about $5.2 million in 2012, we've essentially contributed to charity care or write-offs for individuals that had either very little insurance or no insurance. And basically, we see that as our responsibility, and we do it gladly. Our community benefit programs, we're very happy with the success we've had with these. Let me get the information on that readily at hand. We had over 100 community education classes this past year, largely across the 5 categories of activity you see up here. As well, we had numerous partnerships with community organizations here, and we essentially spent over $145,000 in sponsorships and support for these various organizations. We also have opportunities to provide more than just signing a check for a lot of these organizations. The 3 that we reference up here have a lot to do with youth and school activities, and essentially we provide time and teaching capabilities from our registered nurse staff as well as our medical staff to these various organizations. With that, I'm going to turn this over to Alex and let him give you a rundown on some further detail of some of the initiatives we have going. Alex?
So another thing we're very proud of is our efforts around sustainability. And, you know, our building has won numerous awards over the last 3 or 4 years. Starting in 2010, we won an award for, by the 2010, the Puget Sound Better Bricks Award. We actually were the Building of the Year from the Daily Journal Commerce, and actually beat out the Bill and Melinda Gates Foundation building down in Seattle. We've won a whole bunch of awards around engineering, a number of ACER awards, and we've also were a case study by Puget Sound Energy around how to partnerships between owners and utility companies. We also, it's more than just energy conservation. We actually are EnviroStar certified around our landscaping and grounds maintenance as well. So if you look at our overall performance, our commitment when we built the hospital was that we would try to have an energy goal better than 150,000 BTUs, excuse me, per square foot per year. And that was really, we set that target based on some of the stuff that we found around other Seattle-based hospitals that were running about 240. And in fact, Puget Sound Energy said it was around 250 in the Northwest. So we said we want to take what other folks are doing and do it substantially more efficiently. Since time we opened through May of this year, we're actually running at 110. So we're very proud of this. We're 26% below our goal and 54% better than average hospitals in the Seattle area. And I found this kind of interesting. If you convert that into metric tons of CO2, average Seattle hospital, if we built Issaquah, the same standards as the average hospital, we'd be using about 10,800 metric tons of CO2 a year. We're using 4,100, 6,700 less metric tons of CO2. When you look at barrels of oil, you know, 15,670 less barrels of oil. Look at gas at the bottom, 755,000. So we think we're very proud of this. We're definitely interested in pursuing this and continuing this into new developments up at the Issaquah Highlands and the Donut Hole. So we are growing since we opened. This is a list of not every service we've added since we opened, but it's pretty comprehensive. We've added a lot of new programs to our campus, and Chuck was alluding to this earlier. We opened our Level 2 nursery July 8th, and right now it's in an 8-bed wing of our hospital. We're actually going to hopefully go to permitting and start construction later this year on permanent space for a 15-bed unit. And these things this program and other programs are largely funded through our foundation and gifts from the community. So here's some of the programs we have coming up later this year. We are opening a weight loss and bariatric surgery program. We hope to open that around October or November. We're doing a lot of work around expanding our women's services, including we're September 11th, actually, we're starting a new service called 3D mammography, which is a much better technology for breast imaging. We're opening a midwifery program, and we're looking into the development of a women's center. Over the last 6 months, we've added 25 docs of various specialties, and over the coming years, we plan to significantly grow this. In fact, over the next 2 to 3 years, we're anticipating we need to add at least 40 new physicians to our campus. And the problem we have is that we just don't have the space. So that's obviously why we're here today, talking about what we all affectionately call the donut hole. So when Keith was talking about kind of our plans, what we know we need to do is we need to add at least one new medical office building, probably around 150, 180,000 square feet initially. But over the course of several years, we will be adding to that. So how and when we do buildings 2 and 3, we just don't necessarily know yet. And that's why we're very interested in creating a new development agreement that gives us at least to 2027 to develop all the property. We have been talking to the city as well about coming forward with kind of a master use plan, what the site would look like, where buildings 2 and 3 would potentially go. And Jeff, I know at last meeting I was here, you were asking about, what do we do with the site? Is it going to sit there for a long time? We could definitely address that and incorporate that in the planning. We are very interested in starting this as soon as we can possibly get going. So
We have kind of a hard stop facing us excuse me. We have, I guess I would label it kind of a hard stop facing us with our ability to continue to grow hospital beds. The certificate of need that the state granted Swedish in building this hospital was for 175 beds. And basically the deadline by when we need to have those 175 beds built is the end of 2018. If we do not have if there's a shortfall with basically creating that allotment of beds by 2018, we lose those beds back into basically the King County inventory of hospital bed available for other hospitals to develop. So we're very interested in obviously growing and at the same time need to have the ability to accommodate more physicians than we are currently experiencing right now. So obviously the first priority for us if we're fortunate enough to get this property developed is the construction of more physician office space mostly. And with that, we'll basically then, I think, be able to really see the subsequent inpatient use that'll translate to the need for more beds. So there's our compelling reason, I guess, for the earlier concern you were expressing.
Yeah, great. Well, thank you, Chuck and Alex. First of all, I do want to say that personally, as a longtime resident of the Highlands, that I think Swedish is a wonderful neighbor. I think you've done a wonderful job overall in pretty much everything I've seen. I frequent the restaurant, the cafe there.
That's great.
Unfortunately, I'm one of your numbers on the emergency room sometime in the last year, and I know my kids have benefited from things. I have son plays on Eastside FC. He's an athlete at Issaquah High School, and was a sophomore this year. So all of those things that you showed personally touched my life. So thank you for that, and I'm personally very excited about what Swedish has done so far and the possibilities in the future. So I think they've been a great neighbor to the community, and I think that's wonderful. So thank you for that. First question I have, and I mean,
actually, could I, may I
yes,
for a sec, Jeff? I'm a little remiss in not mentioning it. I'd like to get, if I can, Michael up here for just 2 minutes to give a quick overview of the kind of the what, when, where, et cetera, et cetera. Okay.
Okay.
Great.
Thank you.
Yeah. Jeff, go ahead.
Thanks. And he introduced himself to us earlier, so thank you. So my first question is, you mentioned 175 beds in the 2018 deadline. Did you mention how many beds you have now, or is this additional 175?
We actually opened the hospital with 80 beds.
Okay.
And we actually, though, constructed an additional 40 for a total of 120.
Okay, that's what I heard you say. Okay.
And the state, when we are opening increments of hospital beds, we need to kind of check in with the state, let them know we're doing this. And at this point, we have those beds developed. We've got basically everything ready to go for 120 bed use, except for the staffing and for the supplies.
Mm-hmm. Okay.
So what's left is basically about another 55 beds that are in the form of shell space.
Mm-hmm.
It's not developed, not built out.
Okay.
As a matter of fact, there's some interim uses for those, just because we're kind of crunched on space. In that we've got our sleep medicine program occupying a portion of our med-surg capabilities that ultimately needs to be reverted into a medical surgical unit. So sleep medicine is one of those where we would probably relocate into the new medical office building, assuming we have that available. Likewise, Alex and my offices, we're occupying, not just the two of us, but we have a team of about 20 individuals that work in the admin suite that are also occupying some med-surg shell space. So we need to find space for those current interim uses that are going on.
I see. And then in the donut hole, is the intention, and this is just more out of curiosity, I don't have an opinion one way or the other, is the intention that it's all Swedish facilities, or is it Swedish and buildings that you're going to build for other uses that you would then sublet out to other doctors or services and so forth?
Yeah, so it would be Swedish-owned building, at least the first one. Who knows, down the road. One of our buildings, our medical office building, is actually owned by a developer named Hammes. I think right now our intent is to build all three, and there would be pieces of it that would be that we'd lease out to other community physician groups who are interested, and pieces of it that will all be our own employed physicians.
But you would want to buy the entire piece of land and then
Whole piece of land,
and that
and we
stuff
would
will
develop the entire
figured
thing.
out later. Okay.
Or we would partner up with the developer and probably master lease, the building.
All right. Thank you. That's all the questions I have for the moment. Michael?
If everyone would indulge me for a second, I'm going to take this opportunity to thank you guys. You saved, Swedish saved the life of my son and my wife in surgery and helped deliver my daughter. So I'm very grateful that you guys are part of our community, and I want to take the opportunity to thank you. To make it a little more professional, I'm curious what the building is right above Homer's head there.
Sorry, this is an old picture. This was actually in July of 2011, and this right here was where some of our temporary facilities were for the construction folks that were here, Selling and other groups. You can see that this is the parking lot. This is all one big parking lot now here, and this up here is just a grass field.
All right.
So yeah, sorry, yeah.
Chantal?
So you never saved my life. I'm glad for that. Or anybody else in my family, but I'm happy that you are there.
Yes,
and that you could do it if needed. So thank you for that. I'm looking at the numbers you were showing on sustainability, on greenhouse gas and whatnot. Actually, I also see the incredible high number of outpatient visits, which
Yes.
to me translate in a lot of car trips.
Yes.
What do you do to alleviate, to deal with improving your traffic outside? You have a huge parking area, I know, but do you do anything to alleviate the traffic outside?
Right now, we
Transit,
do have a shuttle that picks up and drops off at the Highlands during peak hours of shifts.
From the
At
park and
the
ride?
Highlands Park and Ride, excuse me.
Okay.
And that right now, and we do have carpool designated spots. We have electric vehicle chargers, 2 of them right now, which we want to expand on. What else, Chuck? I'm missing a bunch of stuff.
Well, I think the reality, quite honestly, is, again, thank you, is that we have free parking, and I think we're one of the unique Swedish facilities that actually has the ability to offer free parking for employees and physicians. And it's a reflection, again, of the community that we're in. Essentially, we don't have enforced parking or metered parking up in the Highlands, as you folks, I'm sure you know. So essentially, we have adopted kind of a when in Rome reality around the availability of those amenities. Saying that, we are fully aware that we're going to have to wake up to the fact that with continued growth, we'll be adding more staff. We'll have a lot more people coming into the campus, and we're very open to basically strategies that help mitigate increased traffic as much as we can. But right now, it's pretty much free parking for staff, and they do take advantage of it. It's actually been a draw for us related to staffing. We've been able to get really high-quality staff that not only live on the east side, but quite honestly are tired of paying $150 a month for parking down at the current First Hill or Cherry Hill campus.
I can add to that, though. I do take the bus an awful lot, and quite often we'll run into people who are looking for the best way to get to Swedish. So
Yes.
I've dispensed a lot of free advice on that, but I'm not sure that it's that there is very easy, accessible ways for that. And I'm actually surprised to hear there is a free shuttle because a lot of people I've talked to were either walking from the park and ride or struggling to make it from the bus stop, which is the closest, the one right after the park and
Yeah,
ride.
there's one about a block,
Yeah.
2 blocks away or so.
Okay. Jim?
Thank you. First of all, I think I'm like everybody else here. I think it's testament to the reach of Swedish that probably all of us up here could, in some way, say that Swedish has affected, our lives somehow. And I'm like Jeff in that I've got a couple of kids that play at Eastside FC, and my wife coaches at the high school. We've had the Heart Smart screening, all that kind of stuff. And I think you guys are even planning on putting defibrillators maybe up at the Preston Park, which if I get any more sediment, if I stop working out entirely like I do plan, I might need to use those. But it's getting back to the number of beds that you guys mentioned that you need to have built by 2018. Was it 185?
It's 175, and the date is in late October of 2018.
18.
Mm-hmm.
The shell, the beds that you mentioned that there's a shell for, are they going to count towards that number, or have they already been counted?
Well, they're wrapped into the 175 granted allotment. The shell space that's available, once we construct and build it out, it'll translate to the remaining 55 beds that get us to 175.
Okay, so they'll all be there.
There's shell space that's been used for other things, basically, in the interim. But those things are going to have to move so that we
Okay.
can build out our permanent inpatient units.
Okay, thank you.
Any other questions before we move on to, yes, Tim?
What is the goal of Swedish in terms of a term for a new development agreement? It was stated earlier that you wouldn't want to extend the current agreement 10 years. What would you be looking for, assuming that, we come up to an agreement and you're going to sign on to that? Are you looking for a 10-year term, a 20-year term?
We were pretty comfortable with the extension out to 2027. We don't know exactly how long it's going to take to build 3 medical office buildings and how much physician demand there will be on the campus. So it would be ideal to extend it. We can go further than that if the city is comfortable with that. We definitely are very interested in hopefully expediting the process so that we can start going and getting through permitting and starting construction of a building hopefully next year sometime.
And what are the consequences of not having 175 active beds by October of 2017?
If we don't have them built out and licensed, we lose them, and we can't, we'll be stuck at the 120 beds that we built out. We're getting ready to license the additional 40 in the next 6 months, which basically means as the community grows, we're going to reach capacity, and we won't have inpatient capacity to serve our healthcare needs of the community. So, and to get more beds, you have to go through a process, a certificate of need process with the Department of Health, and every competitor we have is going to sue us, and it takes a decade to go through that, even if you can get any at all. It's very
that
drawn out
occurred when
process.
you were doing the hospital.
It
There were
took
3 or
us-
4 hospitals that were
Yes.
competing.
Evergreen and Overlake were all suing us.
And they'll sue you because of what reason?
They're trying to prevent a competitor from coming into
To getting more
feels in the
beds.
market.
What happens to those beds, those 55 beds, if you don't get them? That you say they go away, but do they get allotted to somebody else?
They don't. They
go
go
back
in
in
a
the
pool,
pool.
and everybody
Okay.
starts applying for them.
Right.
And then trying to fight for them.
Yeah, okay.
It's
And
chaos. It's a
is it-
crazy system.
Is it safe to say that if you've been awarded a number of beds and you couldn't make those happen, that it may affect how you get more in the future? I don't know
Yes.
if it's, yeah.
I would say so, yes.
Okay. Sorry, Tim, didn't mean to jump on you there. Are you finished? Okay. Carl, do you have a question?
Yep.
Michael, Steve.
I want to one-up everybody on my Swedish. Actually, I haven't.
If he does, he may have to go there tonight.
Yeah. My son did his Eagle Scout project that benefited Swedish, so we're very close to the hospital as well. I wanted to know, is this mixed use? Is this all medical facility? We don't have any specifics yet. Maybe we'll get into that, but is this entirely?
I don't know, Lucy, if you want me to just go ahead and answer it.
Sure.
It is 539, it's actually additional 400,000 square feet in addition to the 139,000 we already have. It's really medical office use, plus a part of that 539,000 is additional 40,000 square feet of retail space. You guys have probably you guys have all been through the lobby. You see we have a Starbucks and we have some retail services, including things, a number of different things.
But I think it's safe to say that we're really focused on healthcare.
Yeah.
The themes even for the retail, really we try to create a medical or health related theme for what it is we're trying to provide there.
So let me clarify one thing. Because and I think it's not a big deal, but I think you'll hear different numbers, and I just want to. It's sometimes confusing. The hospital that was built was, say, 138,000. I mean, 538,000. But at the time that Swedish bought the allowable development to build that, they actually bought 138,000 or 39,000, whichever, plus 140,000. They just didn't include that 140,000 in the site development permit or what they built, but they already possessed that right. They're now buying another 440,000. So with the 139 or 140,000 left over from the first purchase and the second purchase, which they've optioned for 440, that's how you get the 539 for the second one. So there are a bunch of different numbers out there, and the 140 has never been on our radar because we don't have a land use permit for it, and so we've always kind of ignored it other than in terms of tracking allowable development, but it's relevant and it's kind of confusing sometimes when you hear how people refer to it.
So Lucy, this question is probably for you. Since this is the donut hole, looking at the aerial photograph, what is the rest of the donut? How much of that do we know about?
Yeah, that's cool.
So
to the east and to the north.
So I'm going to go up in point.
Yeah, okay.
Thanks. So this is all Swedish existing, and this is all Swedish existing. And this is Proliance, which is constructed. Swedish is looking at the donut hole that Bart's eating. And this area is called blocks 25 through 27. And Devco, who did block 24, has optioned that and has submitted a site development permit for that property, which you'll be seeing in October probably.
Okay. And Microsoft is to the north, right?
Oh,
Well,
that's right.
Microsoft owns this and this, and then everything north of Discovery Drive.
They own that grass piece north of the parking lot, you said?
Right here?
No, just between the road and the parking lot?
This right here.
Up
Oh, this
there.
piece
that's
right,
ours.
that's.
Oh, that's
Swedish.
yours, okay.
Under
And,
Homer is the retention pond,
Retention,
correct?
right.
But Microsoft's pond.
That's right.
Okay. Part of my running trail, actually.
So is the parking lot, is that intended to stay a parking lot, or could that be developed at some point?
That had always intended to stay a parking lot. There's height restrictions currently in place under different parts of it. The only place where we can have any real, structures is this south end of the lot. We've been talking about potentially putting a parking garage on that lot down the road.
So that's
parking
real,
garage, I
I'm
mean.
really glad you mentioned that, Alex. So now you get to watch us make sausage. Those height restrictions were to preserve the views from the donut hole.
Oh.
So I think
know
if
that's
you want to
great to
get rid
know.
of those, you can get rid of those and build wherever you
we-
want.
Let's get rid of those. I formally ask right now, let's get rid of those.
Well, you'd have to talk to Port Blakely.
Okay.
So I have just a couple more quick things, and these are a little bit of a tangent. But if BC is happening, Bellevue College is happening, are you guys in any discussion? Are there any plans for you guys to partner with them on programs? And I think I remember hearing that they were talking about nursing programs there and so forth. So
We would love to. We have partnerships with Seattle University downtown. I'm sure our nursing
Well, actually, we already
leadership would be
have,
thrilled to work with them.
We have a very strong tie with Bellevue College around their imaging tech
Okay.
education resource that they develop. They've got quality people that they graduate from their program, and we employ a number of them. And actually, we are actually a critical element in the training that they go through before they actually graduate.
Okay.
We have a lot of interns and essentially work site study experience gaining for their health careers program. We're very pleased to be associated with Bellevue College.
Great. Yeah, I think it's a real opportunity, and opportunities often if you don't, so that's great.
Absolutely.
And then the other one, this is going to sound really weird, but I mentioned this to Lucy this morning. And I don't know if this is even possible, but I'm really hoping that someone who owns land somewhere west of Highlands and 9th puts some sort of a rooftop restaurant on one of their buildings as a community feature, retail, or, in this case, a restaurant opportunity. I know that's really weird, but maybe it's not. So I just want to throw that out there for some consideration somewhere down the line. If one of your buildings, has a view that could be used in that way, it could be very interesting.
We're definitely not opposed to that.
No, I'm just saying. I mean, I think the community in general is missing that in our current configuration. I don't care who the builder is, who the owners are. I think we're really missing that opportunity.
They can get views to those parking lots.
Yeah,
They have fantastic views from up there.
Yeah. So anyway, I just want to throw that out so that it doesn't get lost in translation, or if I end up being beat up by him later. So, okay. So any other questions? Yes, Stephanie.
And I think this is more for Lucy. If we're pulling all of this out of the Issaquah Highlands Development Agreement, is this still really subject to the urban village guidelines? Is it still an urban village?
So
more
this
commercial?
is going to be a little wonky. So there's zoning, and the zoning is urban village.
Okay.
Okay. So normally with traditional zoning, saying it's, single family 7,200, then there are all these rules that come with it.
Mm-hmm.
But in the city's zoning code, when you get to the urban village section, it basically says work it out through a development agreement.
Okay.
And so all the land use rules are related to the development agreement if you're zoned urban village. So the zoning doesn't change if it's pulled out. It would just mean you're pointing to a different development agreement for the rules for land use and construction.
And then just one other quick question. I kind of read through and I didn't quite understand. But is this development agreement only going to apply to the newly acquired property, or for continuity purposes, is it going to apply to all the property they own?
It's applying the intent. So if it doesn't read this way, please tell us. The intent is that it applies to all the property, and any of that additional 540,000 or whatever it is square feet can be built anywhere.
Okay.
Now, they'd have to come back and show that makes sense, but it's not like that all has to be built in the donut hole. If, without the height restriction, they decided to completely redevelop that parking lot, they could do that.
Great.
As it's written now.
Okay.
All right, thank you, Stephanie. I think Scott has a question. Oh, you don't have a question. Okay. All right, so thank you very much, Alex and Chuck. We may have more for you later. I think at this time we will move on to...
Michael, did you want to have any comment on that?
Oh, yeah, please.
Mike Robinson, I'm land use attorney. I have the privilege of working with Swedish, so I promise not to bore you with a long speech. I just have two things I want to say. One is, let me just point out a couple of sections in the agreement so you can take a look at this later on, and that may answer some of the questions you ask. About the square footage, it's explained on page 5, section 5, that explains what was built with the hospital and what it remains to be built. Commissioner Stevens, page 4, section 1, that describes, Commissioner Preston asked the question about the designation and the property. Paragraph 1, page 4 describes that, and I think those were the two things I wanted to point out to you. And then, Chair Walker, you asked initially why we think we need this, and I thought your question was a fundamental question. It was a good question to start off by asking. Let me answer it this way. We're scheduled to close on this property in December of this year. Current Issaquah Highlands Development Agreement ends in 2017.
everyone understands the change that's occurring in healthcare. 10 years ago, you would have built hospital beds. In fact, I might say I do land use for hospitals in Oregon and Washington. I think it's fair to say it's unlikely you would get this many more hospital beds granted today. That's simply not the emphasis given where we're headed with healthcare in this country. So having these hospital beds permitted is extraordinarily favorable to this hospital and this community. But Issaquah Highlands Development Agreement ends in 2017. If we were buying property with just a traditional zoning ordinance, we wouldn't worry about expiration. We'd know what our zoning was. We'd know what the regulations are. We understand cities can change those, but we would look very carefully at what the zoning was, make sure we could do what we wanted to do. The only assurance that we can do what we want to do is the development agreement. There's no way we're going to be finished either with all of our planning or all of our build-out by 2017. And all of that development is tied to the need to service those beds. And that's why Chuck and Alex explained that it's going to be a longer period, and that's why we've asked you to recommend approval for a term going through 2027. So I hope that helps a little bit.
It does. Thank you very much.
Thank you for your time.
Okay. I will say before you go up, Lucy, that if there's anybody from the public that would like to speak, we will have a public comment section a little bit later. So, but for now, Lucy Sloman.
Good evening. So, just to kind of just to sort of re-summarize some of the things I included in the memo I sent you early July. Port Blakely is winding down their responsibility. They're selling a lot of pieces of their property. I think Swedish has done a really excellent job of describing some of the reasons that they're seeing the advantages of this. You may not be aware, but there are in each development agreement, there are the minor modifications that can be handled administratively, and then there's sort of the big ticket items that have to go back to the council and are called a major modification. This is essentially like a major modification because we really aren't trying to reinvent a lot of pieces. We're really building on the excellent work that we've done through Lakeside and Raleigh, and we'll kind of talk through that tonight to understand how we're using those. And it really will allow us to update the agreement to this century. So my thought is to go through each section of the agreement, give you a very brief introduction of what was the original document that we started with, or why we started with something new, maybe some key pieces or things I think it would be helpful for you to know, maybe how they were changed. Gives you guys an opportunity to ask questions. The plan is not to go through page by page. If you have things that you would like to talk about, feel free to bring them up. If you have small edits, maybe you just email them to us. I mean, I'm sure there are typos and things, but I don't think we need to talk through all of those.
Lucy, over here. One thing as you go through, if you could highlight things that are sort of, I wrote down in my notes, sort of supersets of what we currently have, and if there's something that's maybe below, to Keith's point, that the codes have changed since the original development agreement, so that we're not only seeing things that are maybe more stringent, if that's a word, but if there's a area where things are maybe less stringent, if that's the proper phrase, that would be of probably the most importance, because we're somewhat familiar with the development agreement. I don't think we all have the Issaquah Highlands development agreement memorized by any stretch of the imagination, so things that you can pull out to that point would be important.
And let me, there are a couple of places, but I think that might be a good introduction. There are a lot of chapters of the Issaquah Highlands Development Agreement that we eliminated. There's no longer quarrying taking place, so we don't need that. We eliminated the appendix on critical areas. We think that's all been addressed, that there are no critical areas, but if for some reason there was a critical area, we would revert to city code. And that's true with every development agreement. If there's something that's silent, you go to the city code. But things like, since we don't think that's a relevant issue, we just didn't include a chapter on it. Primarily, the one that's changed is around utilities. We'll talk about that a little bit when we get there. I think that, I don't know whether there's anything that's less stringent. I think that that we felt that the work that we did with you on Lakeside and Rowley is so much better. And it captures, hopefully 90% of what we've learned over the last almost 20 years of working with you guys. And that was a big part of it. I mean, one of the reasons there's so many conditions on the Issaquah Highlands permits, it's all those things that we've learned that aren't overtly present in the development agreement. And so we just feel that it's a lot more predictable, it's a lot cleaner, and it's a lot clearer to use the tools that we've developed over the last couple of years than the tools we have currently in the Issaquah Highlands development.
And I have one more
Sure.
question, I think, if I may. I noticed that one of the larger section in here is signs, and it made me think of the discussions we had a long time ago about the signs on Swedish. Nothing to the donut hole applies to the existing Swedish facility, correct? As we're going through the development agreement here, nothing would apply to the other building?
She just said that it will apply to everything that Swedish owns.
Everything that Swedish, oh, okay,
Now,
sorry, I missed
they
that.
would not be, I can't think of anything off the top of my head that isn't in compliance with the development agreement, but let's say their sign, I'm making this up, is not in compliance. They would not, I mean, we've been clear that they do not have to go back and retroactively bring everything up to code unless they were adding a new code or replacing a sign that was there. So,
Thank you. Sorry, I missed that.
And I do have one question regarding timing. So, we had a very long set of discussions, or a lot of discussions for Rowley, but we were on a real tight deadline for that year. Lakeside also a deadline, not quite the same, but also pretty heavy. Where are we on this in terms of the expectation to get this development agreement to a place of recommendation or not?
I think we have till 2018, right? So it's not different. I mean, I think the goal is to do this relatively quickly because we feel that we're compiling from existing development agreements.
But there's no December 31 deadline like we had with Rowley, where we had to have it done by the 31st. Obviously it was a much longer process for us because we were starting from scratch almost.
Well, I mean, there is a pending land use transaction that they're.
Well, that's why I'm asking the question. I want to be respectful to the process, and we're not going to deliberately drag our feet, but at the same time, if we go through a couple of meetings and then all of a sudden we're rushed to make a decision or a recommendation now or tomorrow or whatever, I think I'd like to know that ahead of time. So I'd like to get an understanding of the timing of the process.
So originally we thought this development agreement was going to be adopted in mid-September.
Of this year.
We've pushed it out to mid-October.
Okay, well, at least I know what you're thinking.
So Jeff, can I add? So the first thing is I'm not involved with you guys much anymore, as you know, and some of you are happy.
Who's this guy?
My understanding is you guys have other things that are in the queue. So Bellevue College, as we mentioned, you've got a DevCo project that's kind of queuing up. So there's other land use actions that are on your docket, all to be done by the end of the year. This, as you heard from them earlier, they have a pending purchase and sale agreement that they want to close on by the end of the year. When they came to the city and asked for the development agreement, they expressed a hope that we would be done, as Lucy mentioned, by September. Well, I don't think that's going to happen. Where we are with you guys is, we're going to go through this in a couple meetings and see how things go. If this makes sense, and if you don't see any issues, then I don't think anybody here is looking to drag this out because there's other work to do. If you guys need more time, I don't think any of us or Swedish want to make you uncomfortable and try and push this through a recommendation if you're not ready to do that. So to answer your question, I think you have as much time as you want. If it's going to take more than 2 meetings, we may have to talk about whether the commission would be willing to have maybe an extra meeting on an off week to try and keep some of the other pieces moving that we've also made commitments to that are not in this room tonight.
Great. That's exactly what I was looking for, just get an understanding. And then my final question associated with that, because you mentioned, it made me think of something. Is there any outside opposition to what we're talking about here? So are we going to run into, I mean, obviously we don't have anybody here tonight, or at least I'm not sure if we have, I'm not sure this gentleman back here, if he's part of the public to oppose this, but is there any stated opposition so far that we should expect to see coming to us?
I don't think we've received any comments yet.
Okay.
We'll see what happens.
Right.
As there's more press, we're putting up a website of all the materials.
Right.
So.
Okay. All right. Great. Thank you.
So I'm going to walk through this. I want to let you guys know that at the end of sort of each of these sections, I want to give you a chance to add further thoughts or comments or things you want to put in there too. I'm going to start with the main body. So the main body is the contract. It is a technical and legal document. So I'm not going to focus on it very much, other than to say that that is where, for instance, as Mike pointed out, in sections 5 and 7, it establishes both the existing and the future, therefore the total allowable development. And in section 14 is the December 31st, 2027 proposed deadline, build out.
So I'm sorry, on the edits, the blue edits in here,
Yes.
are those edits, so what's the base
Yeah, no,
document?
thank you. I skipped over that, didn't I? Michael did this one. Michael Robinson, Swedish's attorney. He started with Lakeside
Okay.
as the most recent document. And also, all of them build from Issaquah Highlands, but because law changes and the attorneys work through this, the city attorney and the master developer's attorney, it seemed prudent to start with the most recent one. But because there were a lot of changes, we didn't do it editorially.
Mm-hmm.
However, that one section got changed after Keith and I were on vacation, so I think Candy decided she should insert it editorially, just so it was clear, at least to us, what had been changed.
Yeah, that helps to understand what the base document is, and so we're expecting to see an Italian hillside hospital? It's a little lakeside joke. Yeah.
Michael got it.
Thank you.
So you can see he worked on the document. So are there any questions on the main body?
Just, yeah, one more question.
Sure.
I don't think, you don't want to be asking about that. I didn't realize the term. Why 2027? Why 14 years? I mean, with Raleigh.
It was 10 years past the closeout of the Issaquah Highlands one. So it was the end of Issaquah Highlands plus 10.
Thanks.
It was very scientific.
Any other main body questions so far? No?
So another piece of the main body is one of the UVDC's great inventions, the consolidated definitions section. We are big fans of this now, so we thank you all for that. I started with Lakeside because that was the newest one, but I did compare it to Raleigh because there had been some changes. So you'll see that, for instance, master developer versus project administrator gets taken out. There were a lot of definitions around housing, and since Swedish is not interested in being a housing developer, all the definitions related to residential have been removed. And then there were some unique lakeside terms like the village square and things that aren't particular to Swedish, and so those were removed.
Okay. I'm sorry, Chantal, go ahead.
It's actually two terms that I thought were missing. One that I had to look up, which is muse.
Oh, okay.
And then one that I knew, but I was wondering if it was going to be explained, which is Wolford,
Oh, a Woonerf?
Woonerf.
Yeah.
Woonerf, whatever.
And I have a couple of quick things. Back on page 9 of the main body, and this is sort of germane to the conversation we had earlier today, Lucy and Keith, set transportation improvements. Not knowing what's going to happen on the Microsoft property and, not seeing yet what the DevCo property is going to look like and really what's being built here, what's the responsibility of landowners that, in a development agreement that we do now when things change over the next few years and, theoretically you could have a ton more traffic through this, through DevCo, through the Microsoft property, whatever that ends up being, and they don't meet the models of yesteryear.
So this is something we didn't talk about, so I'm really glad you brought that up. The allowable development that is in this proposed development agreement is original allowable development entitlement from Issaquah Highlands. So the 1.8 or whatever it would be, million square feet is from the original entitlement of Issaquah Highlands. So that the mitigations, the road improvements, the traffic modeling, all of that stuff was in the Issaquah Highlands Development Agreement. So this is not additional entitlement, this is original entitlement.
Right. So I guess that's fine, and that's cool. But if all this other if all this other stuff comes in and goes beyond that, does the onus then on them to make improvements?
So if, for instance, Microsoft came in, whoever bought the Microsoft property, which has 1.2 million square feet of entitlement, let's say they wanted 2 million square feet, then through that request, they would have to address the impacts of the additional 800,000 square feet.
Okay, thank you. And then my second thing is, and I'll thank Carl for this, but in the definitions we have bicycle parking space, but there's no motorcycle parking space, and does that tell me that there's no motorcycle parking?
So we started with the Lakeside Development Agreement, which has required motorcycle parking.
But it's not defined in the definition.
Well,
and I don't know if it needs to be. I just wanted to point
I'm not sure that it does need to be because there are dimensional requirements for both motorcycle and vehicular parking, but bicycle parking is a little more amorphous. It's not a certain square footage that's striped out, and that's why we define it, so that someone couldn't say, yeah, that chair, that's my bicycle parking.
I got it. Thanks.
Okay, I'm going to move on to, do you guys have anything you want to add about definitions or main body? Okay.
There's nothing real magical about the 2027 date. Like I said before, we don't know exactly how long it's going to take us to build out all 3 buildings, so we're happy to discuss with the city different dates, and if we want to do it a little later, we're happy to do that too. So,
thank you.
You didn't invite me, but I'm going to go ahead and talk.
You should be sitting in a microphone so you can just
So just to clarify one piece, the reason why there's a signature line in the main body for Port Blakely, it's actually Grand Glacier is Port Blakely, because the main body is the instrument that actually, the contract that takes it out of Issaquah Highlands and makes it its own development agreement. And so they have to be a signature to that action. But once that happens, then Port Blakely no longer has a role in the donut hole. So just to be clear about how that would work.
other than the ARC.
You had to go there.
Okay. Oh, the hands went up.
Who had a question there? Stephanie.
I was going to say, are there areas that are going to be, like you talked about signage, where they wouldn't necessarily have to change signage, but are there going to be other areas that would possibly be grandfathered in from the original development agreement? And do those have to be spelled out as grandfathered in, or are they automatically subject to the new conditions?
If they're not changing anything, it would not require, they would not require them to bring it up to code if it was not up to code. But at this point, I'm not aware of nothing, I haven't thought of anything in which they wouldn't be compliant.
Okay.
So what about, I'm sorry, to follow on that, the opposite direction, if there's something more favorable and they want to retrofit, the current Swedish property for, I don't know, whatever it is, that would be okay because it's in the new development agreement. Okay.
So the parking range is different.
Yeah.
So if they got super aggressive on transit or transit, light rail came out here in the next 5 years, which won't happen. But if it did, and all of a sudden that meant that they needed half as much parking, they could take out half the parking as long as it was within the range.
Right, okay.
But to be clear on the piece, so to get to Stephanie's point, so there are stuff that's land encumbrances. So like, for example, being part of the Homeowners Association of Issaquah Highlands, that's an assignment on the property and won't change. It doesn't come out of the development agreement. It's actually recorded on the property.
Okay. Chantal had a question.
There may be a follow-up on it. Was there a follow-up?
I'm sorry?
Okay.
So
I did have a...
what Mike is, I'm his puppet. I'm the dummy. In section 14 of the main body, the second paragraph, it says that we don't impose new standards and things during the build-out period.
Chantal.
Yes, so my comment, and I don't want to sound like very single-minded here, but related to 2.2, which is no major off-property transportation improvement will be required, that yet there's pretty big sections on...
I'm sorry, what page are you on?
The agreement, page 4, 2.2.
Thank you.
I mean, there's pretty major sections on transit friendliness and I don't know if it talks about reducing car trips or whatnot, but it certainly talks about being as transit friendly as possible. The conditions right now do not allow the development to be transit friendly. Why are we? Is there no option, no way that an agreement could include some provisions?
I'm going to let Mike speak.
Okay.
I was going to say, who's the puppet? Commissioner Stevens, the section you pointed out is intended to apply to off-site improvements like adding lanes or building a new road or adding a traffic signal.
Or contributing to Metro or to the city, that's 200 or something
well,
like
the question you asked about transit support is a timely one. We had a spirited discussion this morning about how to achieve that. This section doesn't prohibit us from doing that. There'll be a separate section addressing transit. So these are physical off-site improvements supporting the transportation grid. Okay. What you're talking about is not precluded by this section.
Thank you.
Does that answer your question?
It does, yes.
Okay,
Good
thank
question.
you.
Commissioner Beard.
Yeah, I have a kind of an interesting question here, I think. If we have a goal of sustainability metrics, like X amount of thing based on square footage, can they use the existing Swedish property, which has a number of those, to meet those goals for the total property?
You're right. I think that's a great question. The sustainability chapter is being prepared right now, and I think it is a really... It's in the ether. So I think that's a really great question, Michael. How does that figure into whatever proposal is being made? So, duly noted.
Thank you. Were there other questions before we scurry our way out of the main body? Yes, Tim.
The July 16th synopsis of these changes says that parks and plazas are eliminated. Can you elaborate on what exactly that's going to mean as far as the development of the property and green space?
Parks and plazas are not eliminated in the sense of they will not exist. The original Issaquah Highlands Development Agreement had a chapter devoted to standards for parks, plazas, and Vooners. most of the regulation of those kinds of public spaces, even over the history of Issaquah Highlands, has been, we've used the guidelines much more than we have the standards. And so we just folded all of the stuff related to parks and plazas into the guidelines, and are using that tool as opposed to having some guidelines and some standards. So the expectation is that there still would be parks and plazas.
Okay. All right, so we've gotten through the main body, and any questions on definitions or concerns? Now, just because we're going through them, it doesn't mean we can't go back to them, but let's continue
Wait.
forward. What?
I'm teasing.
Really? Oh, okay.
So, Appendix A. The Appendix A was a pretty unusual beast and not very easy to use in the original Issaquah Highlands Development Agreement. It was a great vision tool, but we've really, over the years working with you guys, changed how we wrote the goals section versus the guidelines section, and there was a lot of blurring. So, and there was also a lot of things that we have looked at in goals for the more recent development agreements that were missing, we felt were missing from here. So we took, we started with the original structure of Issaquah Highlands and added all those goals and objectives into it, and it just was a very cumbersome document. So we reorganized it around, I think, 5 or 6 themes that we saw, which is the way other development agreement goals have been structured, in 6 to 10 themes. And that's what you see here. I will point out that I believe, I did this a while ago, but I believe where you see Issaquah Highlands guiding principles, those are quoted verbatim, because the intent was to provide that as kind of the umbrella tie between the Issaquah Highlands Development Agreement and this development agreement.
Okay. What happened to numbers 1 and 2? Did you mention that?
So 2 shows up on page 4 under circulation, and 1 is on page 6
okay.
under sustainability. I really did take them, keep the numbering, the whole thing.
I'm sorry.
That's,
Okay.
but I mean, it
Bounced
is a
them
good.
around. Yeah.
It is a good point that it is a little confusing. So maybe we should renumber them.
Well, I would suggest once we. I mean, I like that they're numbered the way they are now because we can refer to where they go. But I think ultimately they should be renumbered if they fit in those new sections more appropriately.
Right. I think that makes sense.
Okay.
Lucy, quick question.
Yeah.
It's mentioned, the city comp plan is mentioned in there. Nothing about the Central Issaquah plan. Was there anything in the Central Issaquah plan that would tie in?
Yes. So we worked together on the Raleigh Development Agreement, which is part of the Valley Floor. After that was adopted, much of that was used as the launching pad for the Central Issaquah plan, filtered through all the public comment and the, I don't remember what it was called, but the committee that worked on the Central Issaquah plan. And so we didn't fold it back this way because this is a very specific document. I mean, it's a development agreement, which is different than city code. However, we have, when we get to the processing, I'm just going to say it this way so I don't burden your brain too much. When we get to the processing appendix, I will specifically speak to something that's come back from Central Issaquah into this document.
So, any questions on these goals and principles sections? Scott?
Thank you. Moving ahead to page 5's goal 3.2, subsection 3.2.2, and this is more of a question in light of some previous conversations we've had around circulation and narrow passageways, if you will, specific to roadway. So the statement here is they should be narrow as possible in order to reduce the amount of impervious space dedicated to vehicles, while still providing safe and adequate travelways, including for service vehicle access on-street parking. So as I look to the image up on screen here, the north to south primary passageway down to the facility has parking on both sides.
You mean like here?
Correct.
Uh-huh.
Which, again, in the theme of being narrow, is notably narrow. So as we continue to look at the development within, are we going to revisit the definition of what narrow is in light of our previous week's conversation? I think it was next the roadway just north of the theater. And parking
So
constraints.
it was not our plan to revisit these streets.
Okay.
They are built wider than any other streets in Issaquah Highlands.
Okay.
I know that they do feel narrow, and it has been a topic of conversation, which I imagine we will continue to have with Swedish. And the challenge is trying to strike a balance between keeping traffic speeds low, especially on a very long block. Those blocks are currently 700 and 800 feet long, and yet having people drive at the appropriate speed and, you know, have them functional.
Okay.
So that's where things are right now.
So if new roads are built, which they will need to be in this donut hole, if further discussion on this widens these roads a little bit to whatever number, I don't know if that will happen or not, would that only apply to what goes in new? Because I don't know who's responsible for these outside roads and who would want to take on that responsibility financially to widen them if it was allowed.
So those roads are public right-of-way currently. But, you know, private permits on private property often impact, you know, you're building a driveway, you're building a new intersection, and you make changes. So, you know, it's something that we can talk about, and when we get to the circulation section, we can look at the standards. But right now, the standard that's proposed for those roads is the same one that they're built to.
Okay, thank you. All right, anything else in this first section here, Appendix A? No? Okay.
Anything you guys want to
Anything
add?
else from the applicant here? Are we calling them the applicant here, the partner? What is it? What's the
Master
appropriate
developer?
term? The developer? Our friends? Whatever. Okay. All right.
So, Appendix B.
Yeah, I think you know, if we can get through at least one more this evening. It's been a long day. That would be great. And I'd like to go to public comment at 8:40 if we can, as planned.
Okay. Appendix B. We started with the Rowley guidelines. The reason we did is it's somewhat more urban and more geared to non-residential. However, because there were some edits to the Rowley guidelines that we thought improved some of them when we worked on Lakeside, I went back through and compared them and folded those in. Note that the photos and captions were not, the changes to those were not shown legislatively. So you can't, unless you went back and compared to the other document, you can't tell where photos and their captions were changed. We inserted, as Alex Gross noticed today, a lot of pictures of Swedish existing campus. It seemed like, you know, everyone's pretty happy with it, and we're trying to create a holistic district, and so it was appropriate to reference that. Things that were residential were eliminated. In circulation section, Rowley had a lot of, the approach we used with the Rowley Development Agreement was to insert a lot of the description of the roads into the guidelines, and we found that kind of cumbersome. So we, both in Lakeside and this development agreement, removed guidelines related to specific roadway types, and that's all in the circulation section. The format of this document will be, because it's legislative, it's really hard to format it. So until we get to the final language, it'll look kind of weird. Section 3.7 on page, oh, thank you. Page 23 was added to address tank and mechanical screening. It wasn't so much that we felt that there were not adequate tools, but we just thought this, again, created better clarity and predictability. All the pictures on the right side of that page are Swedish's existing central utility plant. We thought they did a good job, and we wanted to really sort of continue that forward. The pictures on the lower left are from Proliance. Appendix B, page 23, section 3.7. Oh, is the numbering off? Oh, yeah, I see that now. So it's the first page, 23. So that is a reflection of these. Each of these sections is a separate document, and so the page numbers didn't get fixed. Sorry. I also pulled in some of the stair pictures and captions from Lakeside, and wall pictures from Lakeside. Not so much because there's a lot of topographic change, but I think that in working with you guys, those sections improved. And there are some actually sort of steepish slopes between the existing hospital and the trail that goes around the south end. It's kind of off the screen, but this here. And Swedish did a good job, but if we were making changes, there just might be this situation in which that was useful. And then lastly, I would add that I kept the playscape section. There's no requirement that they provide areas for children, but children are likely to be present, and most of the playscape approach that we have used in the recent development agreements is to incorporate children's play as just another user of the areas that exist, and we thought that those were useful to carry forward just as one more user of the campus.
Section 2.1.11 on page 4 talks about overhead cover.
Talks about what, I'm sorry?
Well, what does it call it?
Oh, weather protection?
Weather protection, I was looking for the... it talks about 50 to 70% depending on the level of pedestrian activity and buildings use. I remember bringing that up in the context of the Central Issaquah plan, probably in the Planning Commission. But when you walk downtown Seattle, you have that, it's pretty likely to be about 50% cover and uncover. The covers can be very uneven in the way they offer protections, with some of them providing waterfalls, another one actually providing protection. So I still, without any additional qualifications to that, I think it's almost a dangerous statement to have 50% weather protection?
So we actually have done a fair amount of research on it, and I'm going to be pulling numbers off the top of my head, so I'm not sure I'm going to be right. In working with Swedish on the hospital, we said generally continuous, and there was a lot of debate about what that meant, which was part of the reason that we went to why we started using percentages. With Regency, we used a minimum of 75%, and that was actually quite difficult to achieve. In terms of structures, things that are set back, it was harder than we thought it was going to be. It didn't work well with some building types, like certain kinds of restaurants. It was really difficult to do. So we wanted the flexibility. That's why the flexibility comes with the kind of use, so that we're able to be a little more agile and look at a specific situation. And of the buildings, I think that we did a calculation at the time that we were working with Swedish, so this would have been way before Regency. I think the average in Issaquah Highlands for buildings that have weather protection, and there are a lot that don't, was around 75%. But that was the buildings, not necessarily the block face.
I guess the difference would be the materials that are being used, probably an awning versus a glass structure, and it somewhere does mention that you're supporting a clear, I forget where I saw that. So, yeah, I guess the difference is if you're doing an awning, it can be very annoying. If you're doing clear glass protection, then it's very effective.
So help me I want to make sure I'm understanding what you're saying, Chantal. Is it that you think that you're concerned that we'll only get 50% if that's there, or that there shouldn't be a percentage?
Well, I guess I'm comparing to a straight street in Seattle, which is probably not the same type of situation, where you have a very different type of protection, and some of them wind up being, you get soaked as you're walking from one to the other.
You're talking about consistency of
Yeah.
protection. So one
Yeah.
building owner has one level of protection, and the next door building owner has something else, and so it's not very consistent or predictable for the pedestrian, right?
So in the case of one builder, it's probably not an issue. As this becomes standards for other situations, I think it's more of an issue.
Right.
I think that's a really good point. And I think the other thing is that, for instance, 8th Avenue, which is this Eastern Street, let's say all their retail, their restaurants, everything ends up on that street. It may not, depending on what the routes are and the uses, it may not make sense to put as much. Every entry is required to have weather protection, but not necessarily every pedestrian route to have weather protection. Okay.
So other questions? Yes, Michael.
Yeah, Lucy, I'm looking at page 3 on site design, and general site guideline 2.1.2. And this is the first guideline that pops up here. It says to prioritize pedestrians and bicycles over motorized transportation. And this being a hospital where people generally go to in a state of, I don't know, concern or urgency or diminished capacities to operate a motor vehicle, that being the number one guideline that I read here, for me, that's a much lower priority than easy access and ability to get to that hospital safely. So it's not necessarily a shopping center to me, it's not residential, it's a place where people go to get better safely. So I wonder, I don't think we're really going to change that, but I just did want to voice that concern specifically for this property.
So I think there are a couple things, and we don't disagree that, I mean, we've made certain, I don't know whether concessions is the right word, but certain considerations that this is a hospital, that there are people trying to find their way to the emergency room under this exact kind of circumstances you're describing, and that that has to be clear, easy, straightforward, and we have agreed to certain things that we wouldn't agree to in the shopping center. That said, that is one, 20% or 30% of the square footage. I'm making that up. I don't know what it is. But in the total development agreement, there's going to be a lot of medical office building. There are going to be staff people here. There are going to be people spending their entire day here, either as a patient or as an employee. And so what we're trying to do is strike a balance between that very real, very important need and a lot of other people using this facility in other ways. So it's trying to strike a balance between that.
If I could add to that, I think I agree with you to the extent that the bread and butter of this has to be easy and straightforward and unencumbered, right? And I think that no one's going to go against that because it has to happen. But if you don't put this in as a priority, it could get lost at the expense of even more vehicle traffic ease and use and so forth. I think of Overlake Hospital, which I think has done a great job of improving over the years in terms of getting around their complex in Bellevue. Am I thinking of Overlake and Group Health? But for years and even to this day, there are some parking garages you go into. They're easy to get to the parking garages, but it seems quite dangerous and is not very easy to get to some of their buildings. And I think the pedestrian wasn't a priority in that case, and I actually like that balance. So I hear what you're saying. I totally agree with you from that perspective, but I think calling it out like this is really important as well.
Okay.
So.
And it's good feedback. I mean, we'll look at the language and see if we want to propose any other edits.
Were the lighting guidelines still being worked on? That part was missing from this.
So after Raleigh, we were very happy as staff the way that chapter of the guidelines worked out, but you may not remember this, but that actually was both standards and guidelines. So we've pulled that into a separate appendix. It's, I think, Appendix I or J. So all of the guidelines and standards related to lighting are in that.
Section 9 and under B.
No, did I leave? Does it still say that? Thank you.
All right, so the design guidelines, obviously, each one of these things are addressed in a lot greater detail in the further appendices, which we will go into in more detail than we have tonight, obviously. But are there any other questions or comments from Swedish, or you have something, Jim?
That's why I have that kind of funny look on my face, but...
Oh, I thought it was just gas, but
I
go
know.
ahead.
Yeah. Boom. I'm the setup man. This is kind of getting back to what Scott was saying, in particular that Eastern Road, you called it. And I'm looking down on the circulation guidelines, and in particular 4.1.9 on, I guess that's going to be the first page 23, or is that the second page 23? We already talked about the first page 23,
Yeah.
so second page 23. And it says design circulation facilities to minimize vehicular speeds while considering emergency vehicle response needs. And I guess I'm thinking of the scenario where you mentioned that maybe all the retail might be up facing that eastern road. And if that's the case, usually with retail, people want to park as close to it as possible, which may then increase the amount of use of those, parallel parking spots. And if that's the case, and you can't get two vehicles through on that particular road, if all the, and emergency vehicles wouldn't even be able to get through. I mean, what if you...
So, first of all, those parallel parking stalls are used like 100% right now. Second, the ambulance route is different. So for the general public, they would come down here. right now, ambulances are directed to come around like this, so that they're kind of intentionally segregated, those two groups of vehicular use. Third, the road stand, even though this is an existing standard at Issaquah Highlands, it's wider than the ones that you're used to seeing in the residential areas. The ones in the residential areas were sometimes 6 foot wide parallel parking and either 9 foot or 10 foot travel lanes. This road is constructed with 7 foot parallel parking and 11 foot lanes. So it may not be as perceptible, but it is much wider than, I mean, maybe not much. It seems much wider to me than some of the roads that you may be familiar with in other parts of Issaquah Highlands.
Well, I guess my first response to that would be, well, this isn't residential.
Right. It's called a non-residential street standard.
Yeah. Which way are you guided if you're trying to access the emergency area? As a
down that street. So the emergency room is at the axial end of this little road right here. So you would come down here and into this parking area to access the emergency room.
So I just want to add too that yes, indeed, this. Where's the mouse? Where did it go? This is indeed where we try to direct a lot of the traffic. As part of this process, we are working with the city staff on improving the wayfinding. One of our big concerns is that this property here with Devco, you know, they're going to talk about putting a 5-story building that will potentially block visibility for folks who are in a crisis and trying to get to our hospital. So we do want to try to figure out how can we make sure that people know where to go. With that said, ambulance is directed back here, but oftentimes ambulance traffic comes down this main drag. It doesn't always work as designed for the ambulances to come back around here to the ambulance bay, which is actually right there. That's the ambulance bay. So we have had some conversation with the city staff, and we do want to revisit this conversation about what do we want to do with this road, and how can we make sure that this road is safe for pedestrians, bicyclists, and folks who are coming down this road trying to access our services in a moment of crisis.
And you mentioned Devco. That's one of the concerns I have, that, you know, I don't know how many units they're talking about putting there, but that means a lot of traffic. It means a lot of parking. It means people are going to park off-site, outside of their footprint, probably onto that street if they can.
Yeah, my understanding is that it's somewhere in the neighborhood of 200 units.
Yeah, so that's definitely going to be a concern as we get there. Say again?
Perhaps total hypothetical situation here. In the interest of volume and inbound traffic, consideration for removal of parking spots, parallel parking spots along the west side of the road.
Yeah, or one side or another.
Right.
Yeah. I don't know.
So I think that probably when we get to the site permit would be a good time, when we know where the have a much better idea where the square footage is, if they're adding, it may not be that specific, but if they're all medical office buildings versus other hospital uses, I think that is a time they'll know a lot more about what how they want to configure the site, and we'll all know a lot more in terms of just how it's functioning.
Yeah, absolutely.
Okay.
I guess what I was getting at, though, is that from what I'm hearing, that stuff is more or less grandfathered in. It's not going to be touched by this development agreement if we come out with a development agreement here.
Well, right now it does meet the standard.
Right.
And they would not be required to change it. If they wanted to change it, we could have a discussion about that in the context of understanding how they want to develop the entire site. So this...
So I think there's two questions here. One is, are you guys talking about making it an allowance. So if Swedish, at the end of the day, decided that 8th was a problem and wanted to remove parking, that was allowed in the development agreement. That's one avenue versus making them do it, which you could go either way with the development agreement. That's what this tool is it sets up those future decisions, which, as Lucy said, we'll know more with the land use permit, but what you want to do is make sure that the pathway is available through the development agreement, because that's the contract. So I think as we talk about circulation, which will be next time, I assume, we need to work through this a little bit farther. And are you guys saying you want to just make sure that it's clearly an allowance, or are you saying that you think that they should have to do that? So that's I think what we need to think about between now and the next meeting is which path are we going down? Because if we're going down the path of allowing removing parking on one side, that's already allowed. It's already contemplated as one of the AMMs in the circulation section. So we need to look at the wording and see if it reads the way you guys want it to. If it does, then we're good. If you think it needs to be clearer that it's at their discretion, or if it's because of other reasons that we didn't list in the circulation section, then let's rewrite the wording. That's what this process is about.
Yeah.
So let me just say, so that you can consider this for the next one, is in Appendix E, circulation, the second to last page, section 8.2, which is the case-by-case modifications, where we sort of identified some modifications that we thought might be appropriate. D is already there. So what that says is we think that we're not just putting it in as a outright option, because that means it could happen anywhere. So, but we are putting it here because we want to say that we do think that's a reasonable consideration under certain circumstances.
Thank you. And I actually think we don't like to, and it's probably not a good idea to muddle different pieces of land and development agreements and SDPs and that sort of thing. However, I don't know that I can make a really good judgment or even recommendation unless I know what's happening on DevCo. I don't know that I want to say add, subtract, parking, or widen the lanes or narrow the lanes or whatever until I know kind of what's going on in DevCo, because I think they will both impact each other. And timing may not be such that we can actually make a reasonable recommendation because we won't have enough information on either or both. But I think we need to consider that. And sometimes I feel like we don't do enough of the adjacent property consideration when we're looking at certain pieces of land. So anyway, that's my general comment. Okay, so I'd like to move on, but I don't want to keep anybody in the dark here. So are we good to go for the time being with the design guideline section? Okay, good discussion. Thank you very much. I do have a couple of quick things that I want to ask before we go. Retail, and so this is really for you guys, maybe Alex. Are you just curious? Is the retail intended to be similar to what you've already got in Swedish in terms of associated with the hospital and services, or is it additional retail? Oh, he did? I'm sorry. Why did I miss that?
Yeah, indeed, and the answer is yes.
Okay, so it's not general retail to go to
we
the
want to
general
complement our hospital services,
like the
things
existing
like
hospital
I'm
things
sorry, I missed that.
associated with the hospital.
Okay.
and even services like durable medical equipment, things like that fit well with.
Okay.
And so you'll see some of that as like accessory uses and stuff in Appendix C. So you
Okay.
can look at that for next time.
Okay, thank you. And then in terms of, I don't know what you're going to build over there, but are you going to be looking at things like underground access or overpass exit, pedestrian overpass exit to get people from the main hospital to some of these buildings?
We are very interested in we're putting a sky bridge. We were thinking somehow, some way, a first building would be around here.
Uh-huh.
And we would be very interested in putting a sky bridge from our second floor of
Okay.
our existing medical office building across Blakely into the new medical office building. And even then, potentially more sky bridges connecting the other buildings.
Yeah, and that's what I would expect that. That's why I'm wondering. I don't know where that's covered, if at all, or if it even has to be. But I think it's something that we should think about.
Just mentioning to Mike that we realized that we don't have a section in there. We need to talk to staff.
We'll need to talk about the height. We need to talk about things
Exactly.
like lighting. We need to talk about materials. We had that long discussion about the bridge, the PED bridge across Highlands Drive and that sort of thing. So I think that needs to be addressed.
Yeah.
Yeah, let's connect it with that. Okay, and then finally, for me at the moment, this is really for Lucy. So in terms of oversight, if this is going to 2027, am I going to be on this commission for another 14 years? First of all, and what?
At the rate you're going, yes.
So,
Or no.
but one thing to think about, Jeff, is that the way we've talked about things with Alex, they are A, very eager to move forward because they're pressed for space, and B, doing a master site plan, which means looking at all of their property.
Okay.
So that could happen potentially next year.
And then the follow-up on that is, it comes to us. We will see this, or we will not. We will see it. Okay, you're shaking your head. You're worrying me. Okay. All right. Fantastic. Thank you very much. Okay, any other general questions before we move on? Thanks very much. It was a great discussion, great start to this development agreement, and I look forward to continuing on with it. At this time, I'm going to open up the public comment section for this. Is there anybody that would like to speak? I will ask one more time. Anyone like to speak? Okay, we're going to go ahead and close this. That was the shortest one ever, 12 seconds, I think. But we will reopen it for additional meetings. So if you're interested, I think we have about 1.2 million viewers on average. That if you're interested in coming and speaking, please do so. All right. We have an open discussion section. I think we'd like, Lucy has a Regency update for us. I asked her in a previous meeting to let us know kind of where we are with things on timing and tenants and whatever she could find for us. And Lucy.
So I spoke with Craig Ramey today.
Thank you guys very much. Yeah. Okay. Sorry, Lucy.
So here's the way they sort of see things unfolding right now. Late October, Safeway would be opening. Mid-October to early November is Dick's, Marshall's, and Home Goods. The shops in blocks 2, 3, and 6. 6 is where the cinema is. 2 and 3 are the 2 blocks kind of to the south. And the restaurants like Big Fish in block 7 and Ram in block 4C, they'll be opening from late August to early October. So kind of as each one of them finishes up, they'll be opening. They expect that they will have a grand opening. It is not scheduled yet. It would probably be either kind of early November or early December, depending on how other things open up.
And I should look for my invitation in the May.
They will want a lot of people there.
I'm sorry, did you say November, December?
Early, yeah, November or December. Near but away from the holidays. And they said that all the spaces except for one space in block 3 and the pad between Safeway Grocery and Safeway Fuel, sort of the north end of block 4E, everything else has been leased.
When you said October was Safeway, does that include the fuel then?
I believe that they would not open. They might do them a week or two off, but they basically need to open at the same time.
And the additional tenants, just for curiosity purposes, myself and others, I noticed that their website has the ones that we know about, but it would indicate that there are several that are not leased out or at least not announced. Do we know if you say they have them leased out, but are they announced, going to be announced?
I don't know when they're going to roll them out.
Okay.
I mean, there were some that he mentioned to me, but he said they're not public yet.
I see. Okay.
So I don't know exactly what that means in terms of where they are in the
So I would guess,
cycle.
so Regency Center's website is probably the best resource to go to look at where tenants are going to be located if we want that information.
Right.
Okay.
Either Regency or I would assume that it's ending up in Issaquah Highlands too.
I think Issaquah Highlands links to Regency.
I think they link
okay.
to it. Yeah, they have a visual, sort of map with logos of brands on there, but it does show more than 3 not, identified. So.
Okay.
But that's good news. That's fantastic news. So, and then we talked about motorcycle parking. But what is happening with that in terms of the discussion with Regency? Is there something happening with the discussion with them? Do we need to address that? And any other, sort of things that
So I am going to take, Jeff has provided me with a couple of photos of motorcycles illegally parked.
Not
And-
mine.
And
No,
I was
not
going
safe.
to share that in the parking garage, parking in either ADA load spaces or pathways. And I was going to share that with Regency and urge them to consider doing something about it.
Well, if I can help, let me know.
Right.
Thank
And I'd be glad to put you in touch with them, depending on what their reaction
Okay.
is.
Great. All right. Yes, Chantal. Thank you, Lucy.
Can I ask a question about Regency, on 10th Avenue, the back of Dick's, I think, I don't know what.
Oh.
There's a huge area that has no windows, just blank wall that makes it very unpleasant to walk on that street. Was that planned like that, or was that something that went wrong? Or?
So I'm going to assume that the landscape isn't installed
No,
along that
blank
street.
walls,
So
no windows, no doors, no trees, nothing.
So the back of the building is relatively blank. It is their loading zone. It's a fairly tall wall as the the loading area is going down to access the floor level. But it hasn't all gotten installed yet. The sidewalk at the top of the wall, they've put a more detailed finish on it, and they are providing landscape on both sides of the sidewalk to begin to screen that wall from the pedestrians who are going along there. So it's not.
We'll see how that goes, basically.
Yeah.
So along those,
You'll provide me with feedback, I'm sure.
yeah,
Okay.
along those lines. So I took a little walk up to the bluff that we talked about this morning, but we didn't talk about it. The tops of those buildings look like you're looking down on Fred Meyer, Home Depot. I seem to recall, and I don't know specifically, but seem to recall us wanting to have, and maybe requiring, the tops of buildings to be more attractive in some way. And I don't know why, Dick's, Marshall's, Home Goods is really looking very industrial. And if you're living in those homes or walking up there or driving up there, you're just looking down on, basically on Fred Meyer's rooftop. Didn't we address that in some way? Well, the parking garage, we did, but I thought it was the entire Regency area.
The saga of the roofs. The condition is about screening the mechanical equipment. It isn't about the roof material. And one of the challenges, so the condition only gives us the ability to work on screening the mechanical equipment. The second challenge that we face is recent energy code requirements that the roofs have to be white. It has to have a very high reflectivity of, to minimize the amount of heat absorption, which really limits, and I don't disagree with you. I would have liked to have seen interesting patterns or something, but there's really limited things you can do because of the material and reflectivity requirements. It has frankly been a really big battle with Regency. They have, the screening of the mechanical equipment has been very difficult, and I think they would say very unreasonably expensive. And so even getting that amount of consideration of how things look has been a challenge.
Well, at the risk of sounding like a complete not nice person, I really don't care how expensive it is, honestly, because they're building in an area where we have a very specific set of interests and guidelines and vision, and I kind of feel like we're allowing these big box stores up there in a lot of ways against what people really want up there or have wanted. And so something like that, in my personal opinion, I don't care how expensive it is. If it's the right thing to do, it's the right thing to do, and they need to do it. And we shouldn't give way in any way for them, because I'm sure there are profits elsewhere in this development. Otherwise, I wouldn't be doing it. So I have a little sympathy for that.
Say, Jeff, I
Yeah.
really appreciate you saying that because it has been a huge battle, and I told them they'd be coming back to you guys
Yeah,
if we were going
because
to. change that
in fact,
condition.
I would argue, if I could, to go even further and require them to do more, because now that you see it from above, it looks like crap.
Okay.
I'm going to maybe disagree a little bit, because I think we're also putting things forth in guidelines and standards about sustainability. So you can't say you must do this that completely undermines what we're asking them to do around sustainability.
Yeah,
So
I
we've
hear
got
you.
things in complete tension, which won't make sense. So we've
I
got to
hear you,
keep that
but
in
you know,
mind.
part of sustainability and so forth, I think, Chantel's brought up a couple times, are things like green roofs. Right now, I don't think that something that large is sort of suited for a green roof necessarily. But I don't know that these are opposite goals necessarily.
I just, given Lucy's comment about
Yeah.
it's the purity of the whiteness up there that we've got, requiring them to build a giant snowfield, we just have to be cognizant of that when we're looking and saying, oh, we want you to build that up there and have it perfectly white at the same time.
Well, and I do think the green roof is that would have been a great choice. And Swedish did that on actually one of their roofs.
Mm-hmm.
That was kind of in the back between the two wings, so that, because the rest there were 3 or 4 or more stories that were looking down on it.
Right.
They wanted to ensure that it was attractive.
Yeah.
So there are other ways to do it. It is a big roof. That's a lot of weight,
You
and
don't
there's
need to cover all of it, though.
right.
And the new green roofs don't require the same kind of load bearing as the old green roofs used to require. You can do some surfaces and basically use the current structure or very close to it to do that. So.
Yeah.
But I think it's also beyond just the fact that it's white.
Yeah.
I think
It's
it's great that it's
vast.
white,
Yeah.
but it's also the rest of the structures look very industrial.
Yeah.
Where there could have been some vertical covers made out of wood that would not impact reflection, but would have a more
So
pleasing.
one thing I'm wondering, I didn't say this, is I don't know that the screening of the mechanical equipment's in place yet.
Mm-hmm.
So I assume it's in place for Regal. That's probably the only one that is complete enough that I would feel confident saying that their stuff is in place.
Maybe I can go shoot pictures myself, but I don't know if, I think it'd be nice if we all had visibility into what we're talking about. I don't know if there's somebody that shoots for the city or something that maybe could shoot from the, what's that? Is it you? Oh, okay. Well,
no, I could ask someone.
Yeah, to just get some shots from above so that we can look at it, talk about it, because I don't want to go overboard on it, but at the same time, like I said, we walk pretty much every day, and every time I look down on that, I'm like, I hope it doesn't end up like that. I hope it doesn't end up like that, because it just doesn't fit the rest of the character, and it's not about me. I don't live above it, but I try and look out for the entire community to the extent that I can, and I actually, I don't disagree. We can't tell them do this and do that if they're completely contradictory, but I do think there's a balance that could be struck to make things nicer. I mean, we talked about that with the parking garage, and I think the parking garage so far has done a pretty good job of that balance. So, yes, Michael.
Jeff, working for a large commercial entity like some of them may be going up there, there's a fine balance there for cost for infrastructure for what they'll make back through investments, and I think it may be late to actually change this to a green roof. I don't think that's feasible with the type of architecture and construction they have there. There are things that we could do, like extended fascias, that will not impact the reflectivity or the weight bearing of the roof at all. And to argue on your side of it, we have opened a number of urban stores in Western markets here that have very, very restrictive architectural designs. So we had a building south of here in a major urban area where we're not allowed to touch anything within 3 feet of the street. So that includes glass. So if we have glass break, we have to go get antique glass and put it back in place. So companies will adapt to this if necessary. I have a store downtown where we have very restrictive HOAs because of the condo that's above us, so you can adapt to it. There is precedent set for that, especially as we move into these more urban village type developments. But it may be too late to change the surface of this type of thing, but we can alter.
Yeah, and thank you for that. I don't you know, I don't think we have the place to require massive, very expensive stuff. When I referred to I don't care how expensive it is, it's even for the stuff that they're required to do, they're saying, oh, woe is me, it's very expensive. Well, A, get that done, and B, let's be creative. You know, even if it's something that comes up the side of the building and screens from up above, even if it doesn't cover the rooftop, there might be some interesting elements that you could run up the side of the building that are not load-bearing requirements or would affect the reflective nature of it or whatever. Sort of Chantel's point, you could have some vertical elements. I'm not an architect, and I don't have the answers, but I'm sure there are people way smarter than I am that could come up with creative solutions that would make it look better than it does today. No disagreement on that. People are smarter than me.
It's always been a question of mine, what sort of recourse do we have? I mean,
Well, I think you may want to look at the rooftop guidelines on page 20. And hopefully there's only one page 20 in Appendix B. So, you know, that's something we can talk about, whether there should be an expectation in this development agreement of some different expectation.
again, though, with this particular instance that we're talking about, Marshalls and Dick's, what is the recourse? Isn't it really in the city's hands now to make sure that, you know, the desires that have been expressed here?
So they have a land use permit. There's certain conditions on that permit. We have been very clear that they have to meet those those conditions. The conditions were that the equipment on the roof had to be screened, but the roofs themselves were not part of that condition, and so we would not be in a position to go back and apply additional conditions at this point.
But but you discussed the fact that you've been going back and forth with them on this, on the rooftops.
Just on the screening of the mechanical equipment, because that was what the condition was about.
You know, I guess future caution is, I mean, I think that's a big miss for us, and I'll take the blame on that to the extent that I can. That sometimes we don't know it until we see it, whether it's narrow roads or rooftops or bad corners or whatever they are. But any big buildings that come to us in the future, there are still a few more properties. We should be thinking about that sort of thing. Yes.
Yeah, I have another concern, quite not as at the scale of the wall on 10th Avenue, which really bothers me. And, you know, and it really goes against, I mean, when I was reading through the standards for today's meeting, at times I was thinking, you know, I wish I lived in that place, you know, because there's so much things in there that seems to be, you know, somewhat different from what I live in Issaquah Highland.
Right.
So you know, another one of those.
But wait, before you leave that, when you say the scale of the wall on 10th Avenue, do you mean the length of it?
A length, a huge block of walls with no windows and doors or anything.
Oh, you mean building walls? Okay.
Yeah.
Yeah. Okay.
But yeah, there's another one that's seems to me strange too, and it's at the corner of Highland Drive and Park, I think. It's a building that's kind of sideways. It's the.
I think it's Ulta.
It's what?
I think is it the Ulta building?
It's built sideways in that corner,
yeah.
And it has fake windows.
Oh, I know the ones you're talking about. It looks like there are sort of insets,
right?
And they look like they might be display windows or something like that. But there's no access from the inside.
Right, and that's a very high traffic.
Yeah.
Car people.
I've been wondering about that as well.
Area. And, you know, everything we read about the standards for Issaquah Highlands is that you should have windows at street level. You should have that feeling of interaction between the building and the people and whatnot. And yet they somehow were able to build fake windows there. That.
I think it's.
Sorry, it's reacting really slowly.
Right.
No, it's on Highlands Drive. It faces Highlands Drive and says you're turning onto
that
Federal.
curve there, I think. right?
Yeah, yeah.
Right there,
Yeah, that's right.
where your cursor is.
I'm sorry, you're saying
I
here?
think it's right there.
Yeah, I think it's at Federal.
Okay. Yeah.
I'm sorry, isn't that a positive? Isn't that what you'd be asking for
I would
on the
like
back
bigger
of
windows.
Dick's?
I don't want fake windows.
It's
It's not
They
viable
also
for
want a
security.
secure storeroom in the back.
It's really not. I mean,
I actually don't know what it is.
No, it's the front. It's the front of that. It's what is completely.
Yeah, it's not the front of the store, but it's what's facing the large amount of traffic that's going past it.
Right. Maybe it's not the front.
It's not the front of the store. No, it's actually the back wall of the store. It's very similar to the situation, and I know this because I worked at this company. When you come down 900 from I-90 toward Costco, and the T-Mobile is on the corner there. You know what I'm talking about? Across from the Holiday Inn. That back of T-Mobile, we had a lot of discussion when we redid that store. Because that is their storeroom, and it's got to be very secure. And there was a lot of discussion about light boxes and what can be put out there from a display and window standpoint. It had to look good from the street, but it couldn't. Well, anyway, it was the same type of situation. I don't know what this is going to be, and I do wonder about that myself. So I think it's Ulta, but I'm not sure.
Yeah, and you know what it is? I think. And I'm not trying to say this is the right thing. I'm just saying this is what it is. There are two stores there. There's Joseph A. Banks and there's Ulta. And in between the two of those is a shared loading storage area that's accessed from the parking lot. And then there's trash rooms and storage rooms and stuff that are on the Highlands Drive side. So it's set back, but that was a comment I made. I mean, again, this is more of an ARC issue about the kind of door that was put in, that it looked like a back door. The level of detail of the materials was less than the areas on either side of it. I mean, it was a choice that was made to treat it more as a back of house kind of thing, even though it's facing the street.
The most visible.
Right.
Of everything that you would probably look at. Because you're turning there, it's a nice curve.
Right.
It's probably the most visible facade that you are looking at from most of those stores.
Right.
Yeah, I've been wondering. I'm not sure I'm ready to reserve. I'm not sure I'm ready to pass judgment because I don't know what those are. I don't care if they're real windows or not real windows. I don't know what they're planning to do with it, so I'm not ready to pass judgment on it. But I do wonder what that's going to look like because I agree. It's like insets in the concrete wall. Is what it feels like, right?
Yeah, I thought it was actually not going to be a window, and just yesterday, I think, as I was walking past, I noticed they put glass in front of it, so they will have some kind of a display.
Yeah. Okay. Yes, Michael.
You just made me think of something. We have a store in Kent that has a mural from the 1970s that looks like it belongs in Skate King, and we cannot take it down because it's built into the code. So.
I think I know.
Yeah, and it's kind of embarrassing. We actually painted it over once, and we had to put it back up at cost because of concerns like that. So,
you can talk to Keith about signs.
Yeah. Okay. Anything else before we adjourn? All right. Thank you for that update, and thanks for everything. And we've lost everybody. Next meeting is August 20th, and the meeting is adjourned. Thank you.